Welcome to the Therapy Dogs Australia podcast. I'm Sam King, owner of Therapy Dogs Australia, psychologist, animal assisted therapist, and accredited dog trainer. With over a decade in the field with my team of dogs, I'm here to share practical advice, honest stories, and expert insights for professional therapy dog handlers, dog trainers, and canine enthusiasts who want to live and work ethically and expertly with their canine co-therapist.
And I'm Max, your co-host, Therapy Dogs Australia's creative lead and passionate dog owner, here to ask questions and bring curiosity as we explore this fascinating industry together.
So, whether you're a seasoned handler or just starting out, this podcast is here as a professional development resource to support you and your dog on your journey throughout this exciting industry.
While chatting to a range of inspiring people about our absolute love of dogs and the power of the human-animal bond. And don't forget to follow, subscribe, and leave us a review to help others find us too.
All right, everybody. So this week we are going to have a little bit of a chat about some of the intervention type stuff that we can do with our dogs. We've been talking about dogs a fair bit on the pod, so the training stuff. So we want to make sure that we've got this little bit of balance for you. And I know that this stuff is what people are excited about as well, and getting some ideas and things like that. So
We get really good feedback when we do episodes like this.
Even for people who are like in training, like it's just exciting. Like it's
Mm.
exciting to think about stuff, you know?
Yeah, what are you going to do?
Yes. And so, and that's it's a really common question. Like, so what does the dog do? Like, what does the dog actually do? And the reason that it's tricky to answer is because it's different for every different dog and handler and client setup. So we're just going to have a little look at my diary. I am going to have a little look at my diary and have a little bit of a flick through and just bring to mind some of the stuff that my dogs have been doing in sessions lately. And one of the things that is a common theme, so my client group, kids, so primary school, high school, young adult is the bulk of my caseload. And the bulk of that is NDIS participants, so neurodivergent, so a lot of autism and ADHD. So the goals that we typically have in that population can be varied, but they're often around social communication demand, so coping with activities of daily living. So that means all the things that you have to do every day to just be alive. So
shower and brush your teeth and eat.
What adults call adulting is the adult version of your activities of daily living. So it's like meal planning and doing your groceries, and then
paying your bills,
making sure all the bills are organized and paid, keeping a budget. Yeah, getting a car service, which has been on my, I've got a sticker on my thing. My car is now overdue because I just have not actioned that. So yeah, stuff like that. So clean the house, do your laundry, like these are like activities of daily living. Go to work, exercise, like all this stuff that you have to do just to be alive. And kids have that too. So kids have so many demands, and if they are demand avoidant, even if it's not like to a clinical level, so there is kind of a clinical level of demand avoidance where certain populations can be very sensitive to demand, and they're like, as soon as a demand is put on them, they're like, no.
Yeah, they just can't.
I do not subscribe actually to any of this, and I feel for them because I'm like, I know
all want to say no.
It sucks. And so my mental health clients as well, so particularly my depression population, can just get so fatigued with having to do so much self-care and management all the time just to be able to function at, an average to slightly below average level.
All that work.
All that work. Oh, I get it. I so get it. So demands is really tricky. And if you think about the demands, if you broke down a day, the demands that are put on you from the moment you wake up to when you go to sleep, when you're a child, it is constant, and you're constantly being directed. Unless you're very self-directed, like some kids are just self-directed and these things aren't a big deal to them. But to the kids that are sensitive to it, that is just, they're flooded with demands all day. And so obviously they run out of yeses if they started with any at all. And this is where we end up with issues. Yeah. So we have a few little tips and tricks as clinicians for how we help deal with that sort of stuff. So, giving them like parameters of control and stuff like that. So, and first and then activities and just different things that we can do, like how you frame stuff to kids like that is important. And then that's another demand that's on the parents, is that you can't just tell your kids like, put that away, go and have a shower, like, because I hope you're ready for meltdown number 7 of the day. And a 2-hour, like, I've got a lot of experience with families that have young people who will have meltdowns for hours, like it's hours, and meltdowns that have become violent, very aggressive. There can be an element of just total disrupt, basically. And it's hard because parents run out of patience as well, like, because we're adulting and we've got all these demands on us and all that sort of stuff. So I've got a lot of experience with those households, lots and lots and lots and lots of experience with those households. So I see a lot of kids that have that, kids and teens. So teenagers, it's even sort of, I don't know if it's worse, it's different. They have all these demands on them, but they're like wisening up to like, I didn't ask for any of this.
And they're stronger too.
They're bigger and stronger.
Yeah.
And they're stubborn, and they've realized that we can't actually make them do anything. And that's where we get a lot of school refusal from in teens, and gaming addiction and stuff like that, is because they've figured it out that we actually can't force them to do anything, which sucks. So they develop that sort of autonomy and independence, and they're developing their identities, and they're becoming, even though that's very hard for these populations, identity formulation is really tricky for them, a lot of them. So the crossroads that they're at is, I don't want to do any of this, and I know I don't want to do it. Whereas kids are like, they don't know sometimes, like, that there's all this other stuff to life, because they're so sort of, their household is kind of what they know. And then teenagers, because they become more peer focused, they're like, the world is opening up to them in their teen years, which is meant to. And then they start to realize this is where relationship with parents is vital, because if they decide that they don't respect their parents, like they don't like their parents and they don't respect them as people, because they start to see their parents as people. And if that happens, we're in a bit of trouble, because relationship is what all those 10 years is all about, is relationship, relationship, boundaries, relationship, boundaries.
Imagine this is pretty essential stuff, regardless of whether the child's neurodivergent.
Yeah.
Then it just becomes even more essential. Yeah.
Because the challenges that the neurodivergent young people have are just exacerbated as to the challenges of a typically developing teen. So your typically developing teens in this day and age have got so many challenges already. There's just so much going on, like, for kids these days. And then you add neurodivergence to that, and it's like, everything is harder. Just everything is more difficult. Well, everyone's different on the spectrums of those neurodivergence disorders, but the point is that you have a bucket of things that are just more difficult, and you have to try a lot harder to do certain stuff that other people don't have to try as hard for. But the same is true for our clients with depression and anxiety. They have to just try so much harder. It's so much more effort to get the same result, or even a less good result than someone who doesn't have those challenges. So that's where reasonable adjustments come into play. So, we try and get reasonable adjustments put in place for our kids, because...
Can you explain that? I don't know.
A reasonable adjustment is, so like my kids that are at uni, like they'll get like longer due dates, and
just a little bit of extra help.
A bit of help, like quiet exam rooms. Yeah, there's just certain, and so primary school and stuff, like my kids, some of them they just can't do full-time schooling. Like, it's just too much. The social demand of school is what unravels a big subsection of my kids as well. So the social interaction, which is happening all day.
Significant.
All day. And a lot of it's chaos. it's chaos all day. And a lot of my kids, they just can't handle it, whether they have a high social drive themselves and they want to be involved, or they have a very low social drive and they don't want to be involved. Both ends of the spectrum there. It's just so much, so much for them. They need a break. And so, like this is where animal assisted therapy can be so helpful. And I've found it so helpful in my context, is that my demands feel less like demands. And I'm very, very strong on relationship, which I learned from working with animals as well. So and modeling, which I think I've mentioned a bit before, but you're just modeling all the time when you're interacting with your animals. And I do farm-based sessions as well as in-clinic stuff. So I'll try and stick to the in-clinic stuff, but a bit of farm-based stuff might work its way in there, guys, because I spend 2 days a week at the clinic and then 2 days a week at the farm. So it's pretty evenly split for me. And then the other day is doing just all this podcasting and stuff like that. Or all that one day a week is when I do all your guys' paperwork and
everything.
Get in the school, around the classes, that sort of stuff, dog training feedback in the courses, that sort of stuff is that one day a week. So if I haven't replied to your email, that's why. So actually a little subsection of neurodivergence is, so a lot of people that are autistic are also ADHD, like a huge comorbidity.
Right, okay.
So at one point, I don't know where the data's at now, but at one point it was like, if you've got autism, you've got a 70% high chance of having ADHD. If you've got ADHD, 70% high chance of having autism. So
gosh, because
more
like one
to have
isn't
both.
Enough.
I work with kids that have got 5 and 6 diagnoses.
Oh. Wow.
Which gets like, I think that as the medical industry, I think we do end up just trying to kind of put labels on and to understand, but put labels on collections of symptoms. So the way presentation and then collection of symptoms, and so that we can all sort of try and understand it. So even like pathological demand avoidance, PDA, that I don't think that's been a formalized diagnosis yet, but it's being used, and it's to help people to understand. So this kid doesn't do well with demands.
Yes. Yeah.
But it doesn't need to be its a whole own diagnosis. I don't know. I don't really care about that sort of stuff. But
just trying to understand what they need, I suppose.
You're just trying to understand like the presentation, basically. It's so that clinicians and doctors can talk to each other and try and help families understand, like, you're not alone, for starters. Like, this isn't the first kid that we've ever seen. Like, I've had those conversations a lot with people. Like, this isn't the first kid that I've ever worked with that is doing these kinds of things and having these kinds of challenges.
I'm sure it can feel that way for parents. Like,
absolutely. And what happens,
feeling like they're just the odd one out.
I'll be like asking them questions and stuff and blah blah blah, and I'll be saying stuff, and often people will say to me, "Have you been watching us through the windows of our house? Have you been in our house?" Like,
that must feel really like a relief. Yeah. Validating.
It seems to feel that way.
I feel like I feel like it would help.
Yeah, it just so that it's it's not that often. It does happen, but it's not that often that I'm like,
this is new.
No. And those are really tricky ones that like, and what that often is a lot of intersection of stuff going on. So that's when we start, like that. So there's lots of things that can change or inform someone's presentation. So the family environment at home, but also early childhood, trauma, attachment stuff, like there's all these other things that can be in there somewhere that people maybe haven't mentioned or don't know to mention or don't know about or whatever. And those are often pieces of the puzzle that are missing a little bit too. We also have like cognitive issues, so like intellectual impairment, stuff like that can I work with quite a over the years, but also now quite a group of intellectual impaired young people as well. And so learning is tricky, really tricky. And then all the other factors that layer over that. So kids that have had trouble learning, they have often now become traumatized by the process of learning because it's so hard.
That's heartbreaking. Yeah.
Well,
That's
because it
tough.
sucks to feel stupid.
Yes.
It sucks, especially like because they've got like a very high, like we integrate now in mainstream schooling, which I'm against, even though it's inclusivity. I do get to see the fallout from that, which is that those kids have just been left behind, completely left behind, because they're expected to sit in a classroom with 25, 30 other kids who the majority of them are just doing the work. Like the teacher says something and they just start doing the work and they just sit there like they've got no idea what's going on.
And then you wouldn't want to say anything.
No, and they don't even know how. They can't self-advocate.
Yeah.
Like they don't even know how to ask a question. Like they don't know. Like they just sit there and then, or they just cause a ruckus and they're like, fuck all this, and flip a table and leave. Good on it. So
yeah, we can understand why.
Power to the people. Down with the system. So I'm a fun psychologist for those kids to have.
I can imagine you are.
I'm like, yeah, fuck all that. You know, your parents can't make you go. They've been bluffing this whole time.
Oh,
funny. So then we got the challenge then extends to the schooling. Like, so teachers, educators, like, Lord help them, because that they should not be in the situation that they're in, which is why they're all like scrambling. Like that's why schools are trying to do so much social emotional well-being stuff now, which is like unheard of, mate. Like, what are you doing? Like, that's not their job to do that, but it has become their job because children are delayed in their social and emotional learning. So now they've got all these programs that they've got to do. And, you know, school is meant to be for learning. So, you know, I've got kids that go to school and they don't learn anything at all day, all week. They will not learn one single thing the whole time. Times that by 6 years of primary school. They don't learn anything. Like, why would they go? Like, what are they going for? And then the social stuff is hard for them anyway. They're in trouble all the time. Demands getting placed on them. You know, they're like, see us.
Yeah, no, chaos.
Bye. Yeah, so, you know.
Can I ask, I know this isn't an option for everyone and there's different views on it, but does homeschooling suit some cases where the social demand's less? And
what seems to be homeschooling is when the parent becomes the teacher and they deliver the content. That's really tricky.
Relationship.
Well, and it's that's very challenging then, to be mum and teacher and friend and chef, and, you know, like it's hard and it's a lot of load on parents. The people who do it well, good on them. I used to be like, kids need to go to school back in when I first started out in this industry, and now I'm like, oh god, like it's easier for everyone if those kids aren't at the school. Like, they're just being re-traumatized over and over again, and the teachers that just can't handle it, like, you know, it doesn't work. The system doesn't work. They're getting left behind, not learning anything. So now I'm like all for like homeschooling, but also distance ed, which is like virtual schooling. Like, they log in and a teachers, they've just got classes and that sort of stuff. I've got lots of teenagers that has been a lifesaver for.
Oh, like, really?
Yeah.
Oh, wow.
Yeah. Yes. So the social demands way lower, way lower. But also think about all of the other demands that are involved in getting up for school and getting dressed and all that sort of stuff. They still have to get up and get ready, but it's way lower. But they also they can completely control their sensory space where they are at home, and they can do what they need to do for their breaks. So they can engage in their special interests. They can go for a walk. They can have whatever food that they like to have that maybe they can't have at school, or, you know, whatever. There's lots of different things that are more flexible for them. For the kids that have a higher social drive, I like flexi schools, you have to choose your flexi school wisely, because
Is that the one where you go, like it's part home and then part with a small group and a
no,
teacher or something?
flexi schools are like independently run schools where it's much smaller. The kids don't wear uniforms. They're pretty relaxed on the rules. It's my type of vibe. Like,
Yeah.
I've gone into flexi schools for like, various psychologist reasons, and I love that vibe. It's just chaos. It's chaos, and it's so fun. Like, I'm like, this is great.
Yeah.
There are some that are just like, they're like juvenile detention centers. Like, they're just like, and they will turn your child into that. So there's some, but my highly behavioral kids, like, they might as well go there, but my anxious kids can't go there. Like, they'll be eaten alive on day one. So you kind of need you get pretty good at knowing what's going on at the schools around you in your area, so we can try and help people problem solve that. Flexi schools have a more flexible learning, so they're more flexible in the curriculum, less dumb stuff that they don't need to learn.
Yeah, that's nice.
Smaller class, the whole school's small, so it's smaller class sizes. The teachers are there because they want to be there most of the time. That there's one in my area. If people will know, people who live in the North Brisbane area know what school I'm talking about. There's a high turnover of teachers there, and I know exactly why.
Can you give me an indication?
Because it's out of control.
It's just
out of control. Yeah, it's out of control. Like, just good on them. They're doing the Lord's work. Like, good on them.
Yes.
But Lord help me. Like, I don't know. I don't send certain kids I send there because I'm like, you belong there.
Yes.
Like, off you go.
Chaos meets chaos. Off
and
you go.
You might even be humbled. Like, good luck. I'm so glad you're so tough. I'll see you in. Now, so the teachers are like pretty invested in these kids. So they've got more of that. They have to be more flexible. They have to be more accepting. The teachers get called by their first name and stuff like that. It's just a far less formal environment. The kids, they don't do like the attendance thing, like you have to be here. They're like, if you don't want to be here, go home. Go home. And so then the kids are like, damn it.
Yeah.
I don't want to go home. Like, I don't want to go home. I want to be here and cause a ruckus. It's like, well, you can be here, but you can't cause a ruckus. I'm like, damn it.
Caught out.
Fine. So, which is really cool because you've already got, that's the biggest yes. Like, do you want to be here or not? Yes or no. And if it's no, then they go, that's okay, go home. Go home. We don't want to force you to be here. Like, off you go. So even just getting that, it's kind of like, especially for teenagers and mostly for teenagers in schools, getting that, like, that's kind of humbling. Like, the fact that you're here means that we know you want to be here. So
don't play pretend.
Yeah. One, how embarrassing for you because you want to be at school.
True.
How embarrassing, nerd.
Yeah.
But yeah, no, just gets a yes early on, and then we can work from there. Great. Great. We've got to we want you here. You want to be here. Great. We're aligned. Good. What's next? So lots of very collaborative sort of approach, those schools, and they're better for my anxious kids because it's just less overwhelming and, all that sort of stuff. And all my learning difficulty kids, far better. They'll learn something at those schools.
Do you get information before you see like a new client? You
should.
Yeah, get information before they come in the room and then you make that decision on, because do you have dogs present for new clients as well? Or is it the first one that you don't?
Great question. So best practices that you should not, and I used to not, but best practices that you should not, what you should do is have, the way that it all should work is that you have a referral stream. So it either comes from the GP, so you might have a referral from like a mental health care plan, or it'll be someone that's booking the participant in through so that used to be like 100% of our referrals were mental health care plan.
Yeah.
So now we see a lot of NDIS. So someone will call and then our lovely receptionist who is actually Emily
Emily.
for the clinic as well. She will get a bit of information. So, a bit of a rundown, because she also has to try and help choose a clinician based off of who's available and who the client is. So we need enough information to sort of, because all of our clinicians have got kind of their niche sort of stuff that they like to work with. Mine is hooligans. So
Suits you.
mine is actually no new clients. Books are closed. Books have been closed for a long, long time. But what ends up happening is I get the hooligans that they sneak their way in there. So, so by hooligans, what I actually mean is like treatment resistant, won't engage, that sort of stuff. So I take on the ones, so they either come to me from other clinicians at the clinic. So sometimes we'll move our clients around because we're like, this is going to be a better fit. Is this other person, or this person needs a change or a fresh start or something like that. So there's a bit of that happens. And then, obviously we get all the consents and everything. We'll do a little handover and stuff. But back to best practice. So the receptionist will get a bit of information. And then sometimes that comes to me. So because I'm the clinic director. So sometimes that little sort of information will come to me and I'll go, this is probably, let's talk to this clinician about this client, The problem is that the person who's giving you the information over the phone doesn't always know what information's important, or
Right. Yeah. You might not get the real picture.
That's a very commonly the case. Not always, but particularly with my particular client group is just the complex. So, but those ones, that's hard, man. Like that's actually my job, is to try and figure out that stuff. So it's really hard. I found it hard over the years. It might just be me, but I found it hard, like excluding people, because I just think from that conversation, like it's so challenging to go, oh, well, that's not going to fit. I just think that's really hard to take, because sometimes it's like a support coordinator from the NDIS who's trying to tell us what's going on.
Yes. Yeah.
And some of those are worth their weight in gold and some of them are not. So, that's tricky too. But the NDIS participants, a lot of them come from families that everyone's on the NDIS. And so sometimes there's challenges there with communication and stuff as well. So, and advocation and all that sort of stuff. So best practice, the receptionist gets this and then they go, okay, so this could be this person. And then we go, okay, so you might have a few screening questions around, like people, once they find out you've got a dog, they'll try and access you for the dog. And then, we can sort of do a little bit of figuring out whether that or not that person's going to be the right fit. That's going to be different for every dog. So if you have a dog that, like Oliver, who really wants to hang out, get a belly rub, and maybe we're going to talk about him today, actually, do a few little things. He doesn't want to really work with toddlers. Like that's not his jam. Most dogs probably don't want to, but, like there's going to be certain client groups that your dog's going to be better suited to, and that will also be determined by your dog's strengths and limitations. So one of Nala's strengths is that so how I always talk about like, oh, I just like quietened her down too much. Like, I've just like made her have too much impulse control in the clinic. I actually use that to my advantage all the time. So if we've got especially kids that have been working with the other clinicians and they're hassling the dogs, they can be with Nala.
She's just
chill, man. Like whatever. Or like sometimes we get client groups that they're very stimulated, and so they are seeking stimulation feedback from their environment, and so they come into the environment stimulated, and then they try and like bring everything up to their level. And there are certain dogs at our clinic that are like, you son of a bitch, I'm it. Like absolutely.
Yes. Yeah.
And then that becomes a management. That's really tricky then clinically, because if the clinician is trying to manage the dog the whole time so that the dog's not then adding to this, then that's tricky to then do anything clinically useful for this client. So now, are we working towards the goals, or are we just like
managing the chaos?
And when you can feel yourself, this has happened to me before, particularly at the farm. I can think of at least one. It doesn't happen that often, but actually there's been a handful over the years where I've gone, this environment's too stimulating. Like this, there's too much. There's too many options here. There's too much going on. this person needs to go back inside to a clinic room, and I'll either put them back into my clinic days or to another clinician.
Yeah.
Depending on various other things. So for example, for like farm, like I'm pretty strict on the farm sessions clients. Like that's not an open slather. Like I'm far stricter on that than what I am. But I can be a little bit more laid back with what clients I take into my poor diary because my dogs are so versatile and I've got so many dogs. So if you don't have that, then you do have to be more careful. At our clinic, we're very lucky because there are 1, 2, 3, 4, 5 of us that work with dogs. So we have 6 dogs, 7 dogs to choose from. So
amazing.
yes, that makes it a little bit easier so that, like, there are times when it's like, okay, well, this dog and this client aren't a good fit, but animal assisted therapy is really important to them, and we can see that it is going to be beneficial, but they need to work with a different dog. Just like you would refer on to a different clinician, sometimes the dog is a part of the picture to that, you need to refer on to a different dog. I know there's going to be so many people listening to that right now going, there is no one else like in my space at all. Yes. Hello, me 10 years ago. Have you thought about starting a therapy dog training company so that you can train clinicians so that you'll have more of a referral network? Yes, I did think of that. Thank you, Max. What about opening a multidisciplinary animal assisted therapy clinic so that you've got more referral pathways? Yes, thank you, Max. I did think of that. And that's here we are today.
Well done.
What about getting some credit for it? Actually, I started a podcast. Lol. Actually, hadn't thought about that. So, yeah. I don't think you guys need to start your own therapy dog training business. I think the Therapy Dogs Australia's got all your needs covered. But Max is like falling off her chair.
Oh my gosh.
You're good at quiet laughing. I just like scream into the microphone. I'm trying to like leave because I just like scream into the microphone, and then if I listen to it back, I'm like, who is that annoying lady on the radio?
Yeah, but what's funny is, like, for you, we know if we're listening and not watching, we know you're laughing. Whereas when I laugh, it's just silence.
I'm like, Max just laughed. She doesn't think I'm funny.
Oh, goodness me. Oh.
All right, everybody, now that we've all had a good laugh.
Do you organize your clients? So say you've got a range of clients on your books. Do you make sure that you align them with the dog that you're going to have on certain days?
Yep. Yes. And recently I was thinking about swapping my days for my dogs, and I was like, oh, I actually can't. So anyway, I won't go into, I'll about to go down a different pathway. But so yes, I do. And I also choose, so like farm sessions, time of day. Like,
Yeah, okay.
Time of day is really important because of the limitations of, for example, being in the heat or things like that. So yes, there's all sorts of things like that, but that's like, now it's talking about stuff that like other people aren't going to have to worry about as much because they don't have that choice. Back to first session. So you do need to, it is good if you've done a bit of whatever. It's a good idea to do your intake first before you introduce the dog. I used to have the dog in a crate in another room, safe, in a crate in another room. This is Sunny. And then I would do the first session, do your whole like intake stuff. And then in the last sort of 10 minutes, I would go, okay, well, I actually have a therapy dog. His name is Sunny. Do you like dogs? And they'd be like, I love dogs. And I'd be like, oh, do you mind if he comes in? And then I would talk them through exactly what he's going to do. So when he comes in, he's going to bring his toy. He's going to want you to throw it. He's going to do this. He's going to do that. Da-da-da-da-da-da. And then I'd go, okay, well, I'll go and get him. And I'd go and get him and just let him run in. And then he would do exactly, he was so predictable. He would do exactly, which Nala would do exactly what I'd said he was going to do. And then that was like almost like a real trust bonding building thing too. And then we would go from there. But we have talked about, and I do mention in the courses, like how you advertise your services is really important as well, because if you've advertised like animal assisted therapy available to everybody, that's a mistake, because there are going to be clients that you're like, oh, this is not a good fit. I won't share. We've had some stuff go on over the last 10 years. So there are going to be times when that does happen. So you just got to be mindful that like it's not like an open slather thing. Like even at our clinic, we still say, because all my clinicians do non-dog days. Does Samuel do a non-dog day? Samuel's got 2 dogs as well. I can't remember. He mustn't. But yeah, so we have the option for like, so my other clinics, they've got 1 dog. So they do non-dog days. And so, yeah, it is something that you can do an invite only. And so you start out everybody as, you know, a non-animal assisted therapy client. And then if there's a clinical reason to put this person into animal assisted therapy sessions, then you can discuss that with them then. That's the safest way to go when you're starting out. That is absolutely, I cannot recommend highly enough. That's the safest way to go. If you're trying to get clients and your dog is a part of a selling point, I hear you. I totally get it. Just be mindful getting a client out of your animal assisted books can be pretty challenging. So remember, we don't have the same referral options. So if they want to continue animal assisted therapy, we don't have the same options because they're limited. This is like, there's so many dogs in my area, like therapists with dogs in my area. How did that happen? Whoa. But yeah, it is tricky, especially like the client group that have decided that that's what they need. That can be really hard. So for them to accept that that might not be an option, that can be really challenging. So just be aware that if you overpromise and underdeliver, I personally find that much more challenging to navigate than if I underpromise and overdeliver.
Yeah. Yeah. No, that does make sense. Yeah.
It feels safe. Okay. So, okay, so we're across kind of like the work, you know, people will be listening to this being like, that's my life. I'm like, oh, yeah. Yes, it is.
Relatable.
Relatability score high. So one of the things that I have found fun to do, and this is a activity that you can do as an education professional or a allied health. So all the allied health and educations, but so the educators, let's just define this, okay? For the purposes of this conversation, educators will mean like teachers that are just teaching curriculum, right? The allied healths are the ones who are trying to fill the gaps for the particular client as to why they can't perform for the educator.
So psychologists, OTs.
Psychs, OTs, speechies are your main ones. So sorry, everybody else that I left out. So let's say that's a really typical allied health team, especially for an NDIS participant.
Mm-hmm.
And if we have a participant who has got a bit of demand, avoidance staff, bit of learning staff, a little bit of trauma from all of the learning and demands that get put on at school, and all the trauma of just having no idea what's going on and feeling silly all the time. That's a really common presentation. That's a common sort of background for a little person that we might see who is now disengaging from schooling. They're maybe refusing to go. They're not engaging in the work while they're there. Yeah, there's just behavioral stuff might be popping up. Or they might be just internalizing and just sitting there and like, yeah, just dissociating the whole time.
Yeah.
So with those ones, what can be really cool for us to do with the dogs is to reintroduce them to learning. And I love this so much. I said I love this so much if you couldn't hear me.
Thanks for the clarification, Sarah.
So, do you know what your dogs had to do, guys? Learn. And you know what your dog's still doing? Learning. So, learning and the trauma of learning, the fear of learning, the self-esteem, the confidence, all that sort of stuff is a huge one that we can work with the dogs. So, my job as the psych is to reintroduce the little person to the concept of learning. Because you know what kids figure out early, I remember this when I was a kid, is I don't need to know any of this shit that the teachers are trying to teach you. I don't need to know. I don't need to know the capital cities. That's all that
I
don't need
needed
know
to
that.
know why I needed to know something.
I don't need to know that.
I
That's
still
done.
kind of need to know why I need to know
Yeah.
something.
I just absolutely.
Yeah.
Not understanding that the actual process of learning is what you're learning at school, which is why I have to learn all the dumb stuff that no one cares about. So I'm going to reintroduce them to learning, and I'm going to start building the confidence and the self-esteem throughout the learning. I have to do a lot of frustration tolerance management. So that's where our little person, we could just use me as an example as the client here as well. I'll be the client. Okay. I'll play. Okay. In this example, I will play the client and the therapist.
You
and
roll.
And all my dogs play themselves. The frustration tolerance can be a big factor. So as soon as we start to feel like I don't get it, I don't know,
Yes.
I don't, and then you know how when you don't know and you're confused, and then everything else that the teacher is saying,
Oh, yes.
it's just mush. It's gone. Your internal system starts to rise, like your arousal starts to come up, you start to dysregulate, and then you're like, it's depending on who you are as a person and your attributional style, so like how your personality and all your bloody diagnoses and all everything else will inform what happens now. So what is the trigger is, I don't really want to be here in the first place. This person is now saying stuff that I don't understand. I feel confused. And then what happens next is choose your own adventure based off of like who you are.
That's how you respond.
How you respond. So some people are just going to internalize it. It's like when you ask someone for directions and they like after the second direction, you're just flatlining in the brain, like beep. And I'm like, cool, I just got to get those first two right. Shut up, man. Shut up. I only have space for two. Let me go.
I'll ask the next person.
I just got to get those two, and then I can ask the next person. Which imagine if you've got like high social anxiety, you got communication, you can't ask the next person.
No.
So you just stay walking around the block in circles, just like remember when were you young enough when we had to have Refidexes to drive?
Refidexes?
Oh my god, this is guys.
What's a Refidex?
Oh my god.
Not just the map book.
Yeah, the map book.
Yeah, call it a map book.
That's not called a map book.
What's a Refidex?
Okay. You're gaslighting me live on podcast. Did you have to have it open? I used to deliver pizzas when I was in grade 12 with that book, with the map book.
Oh, we used it all the time. Yeah, the map book, not a Refidex.
Okay. So I would drive around with the map book open on my steering wheel and be like, because you had to, do you remember using it? Like you'd have to find where.
Yes, yeah. And the A, B, C.
Work your way back to where you're starting from. And then you got to sort of try and follow that. And I just have it open on my steering wheel, driving around with it on my steering wheel. And one time I was going down like Logan, Ipswich Way, on those huge highways that go out there. And I got lost and I just couldn't find, it was too far. I couldn't find my way back to anything I knew. And I just like pulled over and started to cry because I was like, I'm going to die here.
The panic.
Because I thought I was going to run out of fuel. I have no money.
Yeah.
Like I was like, I'm going to run out of fuel. And they're just going to find me in this car on the side of the road.
Just like unconscious with the map book open.
Because these exits are so confusing and you're going so fast on these big, huge roads. Like you can't get it right. Like I just kept going off on the wrong exits and like, anyway. So when you're learning something and then you get overwhelmed and then your response ensues. So a lot of my kids, their frustration their tolerance for that is low. So as soon as something is a little bit of a challenge at all, they're like, all right, I'm flipping all this. Okay, I'm flipping all this out, or, whatever, like internalize or whatever it might be. So if my job is to build their confidence and their self-esteem throughout the process of learning, and also to give the psychoeducation around why learning is something that people are forcing you to do, and because it is actually good for you. And I know you don't know this and you don't care because you're a little person, but I'm an old person and I can tell you that learning is important. They don't care about that, right? You can say that until you're blue in the face. Everyone said that to them 100 times. They don't care about that. What you can do is use your dog to model this process as much or as little as your imagination can allow. So for example, one thing that I have done with my little learners is so I'll introduce, how's school? And they're always like, good. They could have been suspended
Terrible.
that day. And I'll be like, how's school? And they're like, good. And I'm like, everything, nothing to report. And they're like, no, everything's good. And I'm like, okay, I know you got suspended.
Liar. You lie.
Okay. So I'll introduce, like the topic come up and I'll go, oh, or you don't have to introduce the topic straight away. So if they're going to be triggered by that and be like, this lady's going to talk to me about school and I already hate her, you can just open up by talking about your dog's learning. And the way that you could do that is you could go, so like, in this particular example, I had Oliver with me. Okay, so Oliver's been doing some learning, been learning some new stuff, new words, things like that. And they'll be like, Oliver's learning. Think of a primary school age child. Okay, guys?
Yes.
So the way is like, how's school? Yeah, good. Oh, that's good. Or they don't like school. I don't want to go to school. Oh, Oliver went to school. And they're like, what? Because their dogs don't go. Like the client's dogs often don't go to school. But yeah, Oliver went to school. He went to puppy school and then he went to adult dog school. And yeah, he likes school, I think. I think he liked it. And then you're introducing your topic and they'll be like, why do dogs need to go to school? Like, what's here? Oh, well, that's where he learned all of his words. Like he had to learn his words there. I think you like spelling words, like your words. He had to learn his words as well. And at this point, I'll be like, do you want to see the words he knows?
Yes.
Yes, I do. Yes, I do. Absolutely.
I'm so hooked in this. I'm ready for learning.
Stop talking about that. Tell me the words. So at this point, so you're just real casual, right? And then you just start writing on I've got a little whiteboard on my wall. So I'm writing sit, drop, spin, shake, high five, touch. So you just start writing your dog's tricks on the board. And interest is now really peaked.
Yeah.
So for this little person, you might decide you can make that so now what I've got is I'm not saying them, they've got to read them. So this little person is now going to read the words and I'm also going to get them to write the words out. Do you know what this says? Can you write that down? If you can write them down, I'll let you see and you might demonstrate the tricks and be like, let's see if he remembers them, and demonstrate them and then be like, if you write the words down, whichever ones you write down, you can maybe have a go of that as well. So all of a sudden, what you end up with is a little person who is choosing to read and choosing to write.
That would work for me too.
Oh, straight away. Like
100%.
I have not met a child that this doesn't work for. Like animal assisted interventions are so magic. It's magic. There are so many times over the years, hundreds and hundreds and hundreds of times that I've ended a session, gone out to the parent, this is what we did. And the parent's been like, how'd you get them to do that? And I'm like, was ask them to do it. And they're like, no. Even tying shoelaces, stuff like that. And they'll just do it. And their parents are like, no, they don't know how to tie their shoelaces.
How do you, for tying shoelaces, how do you go about that?
I'll just write a little note and we'll come back to it because we are terrible at skipping all over the place. I've written it down. Okay, so back to our words. So now we've got this, now we've got that, and now we've got a little person who's doing the tricks with the dog. So the dog's loving it, right? Because we're using treats for the tricks with the dog. So the dog's loving it. And a dog like Oliver, he doesn't get to pull that stuff out that often. So he's now whipping out all his tricks. This is the kind of stuff that's like, okay, so there are some kids that are refusing to do any handwriting at all, refusing to do any reading at all, refusing to do any stuff. You can make that activity as extensive as you want. So one thing you can do, especially educators, use, or Alan Health, where we're introducing kids back into this, you can do this activity and not lose your mind over it. Take out some of the letters of the words and get them to spell them. There's all sorts of things that you can get them to say, spell the word out. Take the list off the board and get them to remember them. What were they? What were the words? Which ones can you remember? That sort of stuff. So you're using now all of their functions of learning and they don't even care. Like, and these are the kids that just won't do it otherwise. So you can let your heart and mind just go to the ends of the earth with that kind of activity, with all of the different, so the more tricks your dog can do, the more words you've got. The other thing that you can teach them new words. So going through the process of teaching your dog a new trick, a new word, very, very cool.
Yeah.
If you choose one young person and one word for the dog and work with that young person on that word with the dog. Don't do it with your other clients, I think, although that could be flexible depending on what the actual goal for this little person is. So when you are learning a new word for your dog, so Nala's been doing 2 of these, it is something that the little person gets to revisit every session. They get to do the process with the dog and learn how to see the dog actually learn.
Yes.
Now, a really fun part of this, if you haven't done any shaping training with your dogs, that can be really useful as well. So the fun part about this is, do you know how dogs feel when they don't get their answer right straight away?
Frustrated.
Very, very frustrated. They get frustrated. So now our little person gets to see that that's actually normal. It's normal to get frustrated. And what are we going to do here? What's our choice? Should we just leave her and let her work through that and figure it out? Should we help her? Should we make it easier? You can go through all of these options with your little person. And not only is it going to give you a lot of insight into them and how their little brain works and what they think should happen, but it's going to give you millions of different opportunities to be okay, well, when you're frustrated, what do you prefer? Do you just want more time to think about it, or do you want someone to show you?
Yeah.
What do you need? They'll answer it, and if they don't answer it, they don't know. So if they don't know, we can go through the options and go, okay, well, now, animal welfare people out there, this is unkind to your dog. Just so you know, this is unkind, because during this process, when all my attention is on my client, my dog is frustrated. So she's having a learning experience that is what is happening?
What do you want?
throwing her button around the room, that sort of stuff. I have to let her. I don't like to see my dogs frustrated like that. That's probably a me thing. Stop analyzing me, everyone. Get out of here. Let's just mind your own business. Just joking. So you have to recognize and fully acknowledge that is discomfort for your dog. And then you need to try and manage that. So I need to let her go through this frustration enough that this little person can understand what's happening. And I don't want to save her from it straight away, because I'm teaching my little person that I'm not going to save you from that straight away.
Yes. Yeah.
Okay. But you do also need to keep in mind that, you don't want your dog, if this is hard to manage, it's a balancing act. If your dog gets too frustrated, they can just quit, just like your little person, and then you've got to recover them. That's not always something, unless you've got experience in doing that, and you should gain that experience. That's not always something that can be done quickly, and it's not going to be good for your little person to see the dog not recover. So by recover, I mean your dog might just quit. They might just quit, and it might be hard to get them to
they might lose interest.
Lose interest, and just give up, sort of thing. So you've got to figure out your dog, what is their capacity. I'm not just going to let her be frustrated. I'm going to have to stop her and put her in a position. So this might be a drop or mat or something like that. And what I would be saying to my little person would be something like, well, let's just get her to take a break for a minute while we think about this. Let's just have a thinking break. Nala, come here on the mat, and remember, she's going to be pissed off, man, because she's what is the answer? What is the answer? So she's going to be having feelings about that. That is something that you need to seriously consider for your dog's welfare. But I'm absolutely doing it. I'm absolutely doing it because it's so powerful. Just be really mindful that you are working your dog when you're doing that sort of stuff. And this is where that whole balancing act, where it's balancing the dog's welfare and the client welfare. That's a really good example of okay, but I'm trying to get this little person to understand what is happening for them every day, all day, what is happening for them, then Nala's going to have to go through a little bit of shit. Sorry, honey. Mummy loves you very much. There you go. And then save her from it. So pull her out of there, back into a control position, drop, map, whatever. And then all your attention can go back on your little person, and then we can bring it all back together again. Now, remember, throughout this process, your little person has to be involved. So there's going to be times when they come up with a solution that is nonsense. Anyone that works with kids knows sometimes their ideas are nonsense, but you should try them because it's their idea. And especially if this is a little person who hasn't engaged well in learning and may not be offering ideas and may not be participating. Guess what, Nala? We're about to be doing some dumb shit that's going to be really confusing for you. Mommy loves you. Okay, so this can be all sorts of like weird stuff. And this is why having a more robust dog will allow you to do more things. So a really silly example of that could be something like, let's put the treats on top of the fish tank and see if she can get it. And I'm like, okay. I was like, why is all my stuff up on the fish tank? Like, I can't get that. And I'm like, oh no, look, can she get it?
Is this the sort of thing that you can plan to do like in the mornings? Like, because I imagine dogs get tired throughout the day.
This is the kind of stuff that I always use food with. I always use food because the dogs just have so much more buy-in. Like there's so much more buy-in. But the example and why we want to be able to work our dogs not on food is because when I go to my little person, like Nala's trying to solve this puzzle example word, this new word, she's trying to learn something. And then I go, oh, she's frustrated. And I try and go like, oh, let's get her to take a break. When I say, all right, on your mat, she needs to just go on her mat and stay there. She can't go on her mat and I'm feeding her treats every 2 seconds to keep her on her mat. That can't be happening. I need to be able to put my focus on this little person and she needs to go on the mat and she needs to model taking a break and calming down.
Yes. Yeah.
That's okay. She can take a break. Calm down. Good girl. You're all right. All right. Let's just all take a breath. Let's think this through. You know what's going to help here? Pen and paper. Get my pens. And then I might have to spend the next 15 minutes going, okay, what's our plan? Because strategizing and planning, that's all part of being a little learner as well. Working together, getting them contributing their ideas. Sometimes these are kids that won't even talk when they come into their sessions. Like this is the types of goals that we've got, is any engagement, especially in like a learning activity. And if Nala doesn't get to go and do, she's been learning to press a button, she might want to do, well, that's too bad. Like, that's not what we're doing right now. We're doing this now. We can't just derail this little person's session because Nala's going to want to keep pushing the button so that she can get treats. Okay, so that's like where our training styles come together, where it's like, I'm putting treats in this activity so that the dog's got heaps of buy-in. But yes, you just need to be aware of your dog. So don't set yourself up for this sort of stuff if your dog can't handle it, you can't handle it, blah, blah, blah. Like it's going to end badly. But the safer thing to do is the tricks on the board. Like these are the tricks the dog knows. You've taught them, the dog knows them, you've got hand signals for them, you've got words for them, you've got all the stuff going on for them.
Yeah.
Teaching the dog a new word is a more advanced skill and you should have practiced that at home yourself. Easy one to do is things like get some plushie toys. So say you've got like a panda and an elephant and teach your dog what elephant means. Which one's the elephant? Just go through the process of that. Who cares how long it takes? Who cares? Because that's learning.
That's so simple too as well. Like this.
Yes.
Yeah.
Yeah. And don't like do it for realsies. Like, because it's not about the dog performing that they know what the elephant is. It's about the dog not knowing what the elephant is. Let your little person see that the dog does not know what the elephant is. Let your little person see that your dog gets it wrong. Let them see that they keep try and get them to re-engage. If your dog does rage quit, use it clinically. Okay. You're going to have to recover your dog after that, but use it. Don't panic and go, I need to fix all this right now. No, you don't, because you can't fix all that right now for that little person. And so you're modeling all of that for your dog as well. That's where having the dog there is so useful. And that's where people who don't understand the welfare tax on the dogs that are therapy dogs, they don't get it. They don't know what these dogs are doing. They don't know what the work is that they're doing, and they don't truly understand welfare, because there is a welfare tax on these dogs that are working as therapy dogs. Let me tell you, if you know dogs, you know that. You know there's a welfare tax. We do everything we can to support them, recover them, decompress, prepare them for the work, all that sort of stuff. There is a welfare tax, and you're constantly balancing that. But your goal is to get this little learner re-engaged back in learning of some kind, so that you can show them that they can do it, and it is fun. It can be fun. And throughout that process, we're going to be increasing all of their confidence, self-esteem, frustration tolerance. Sometimes we need to do activities like this to do an assessment of where their learning's at. So not like a formal assessment, but for me to get an understanding of, so there will be kids that their parents are like, they can't read. And I'm like, well, they just read all those words. So
Yeah.
they don't write. If they can read. They're just refusing to read. They can read. They're not they're refusing to read. They're not motivated to read what you're trying to get them to read. But they can read. They won't write. Well, they can't. They can't. That's not their writing. I've had taken things out, and they've been like, "Whose writing's that?" And I'm like, "That's their writing." And they're like, "They don't.
Wow.
They can't write." And I'm like, "Okay, well, it's not my handwriting. Like, mine's not much better, but."
Yeah.
I know when to use a capital letter most of the time. So that's not mine. I don't write in brown pen. I obviously use purple only.
Yeah.
Gosh. So there's lots of assessments. So sometimes it's like an assessment thing as well for us to understand. I actually have a lot of kids that will do things with me and the dogs that they have never, ever done for anyone else ever. But it gives us an assessment of like, so think about your functional capacity assessments. They're all wrong. That's all wrong. That's all of that paperwork is all incorrect, because that kid, like, if there's all like they can do it. They can do it. Functional capacity, I shouldn't say it's all wrong. Functional capacity assessment is also about what will they do, which in that case, nothing. So, but it's good to know what like that the skills do exist, because then otherwise we can waste a lot of time trying to develop skills that already exist. Whereas what we need to work on is motivation to use those skills. So learning a new trick or a new word. Now, word of warning from the wise. You will need to not really care that much about your tricks with your dog, because the kids are going to wreck them. For the kids to not wreck them, then you are going to be interfering too much, probably. So I learnt this from Sunny. So he had all these tricks, and then I used them in therapy settings, and they all, like, kids don't do it right. So they all get real sketchy, the tricks. They're not as precise. They're not as,
You have some that are off limits then? Like some that you
that's
don't
what that's what you should do. If you've got tricks that your dog does that you really like and want to keep for yourself, do not show them to the kids. Do not show them to the kids. It doesn't matter how many times I say, okay, you've got 5 treats, so you can ask the dog to do 5 tricks. No, that's not what's happening. The dog's getting asked to do 85 tricks. And then once the 5 treats are gone, and I go, well, we're only going to ask the dog to do tricks in the room. We're not going to do it in the waiting room, because it's like there's a lot of distractions, and, because the kids get disappointed. So this is what kids do. They do tricks with the dog, and then they go out to the waiting room and they want to show their mum and dad the tricks. And so they'll be like, shake, shake, shake. But the dog's distracted by everything else that's going on. And also, you've got no food. So I'm not doing shake. And it's so, like, disappointing for the kids.
Yes. It's so good when you show your parents something.
I know.
And you ever want to do as a kid. Yeah.
I know. And I always warn them, like, we're not going to do them out here. So if you want to show mum and dad, we're going to bring them in here. Like, bring mum and dad into here, and we'll show them. Like, I put on trick shows and stuff for the parents before, where the kids are like running the little show, little performance.
I so would have done that. That would have been me doing that. Yeah.
So cute. Stuff like that. So, and like, if you think about kids that are struggling with things like public speaking and stuff like that, like those kinds of things, those skills can be practiced in performing a little trick show. You don't have to have a big audience for that. You can help them. You can be the show director, and you can help them build the show. and set everything up and be their little stagey. And then we can bring a parent in and do the show for the parent. And all of a sudden we've practiced all of this, like, public speaking stuff. And we've had fun and, relationship building and all skills building that they've done, the confidence, the self-esteem, the pride. Some kids don't know what feeling proud is, what that feels like. So we can reflect on that sort of stuff. Like, that's what that feeling is it's being proud. Like, that's what that is. And so
That's a
we
good
get that
feeling.
it's a good feeling. And like, that's what happens and it's hard to feel proud if we didn't do something that was hard. So usually feeling proud comes from doing something that's tricky. So that's why that, like, yucky feeling that comes when something's tricky, that's what you're actually kind of proud of, is squashing that little guy and, fighting that little guy off. And once you have that little fight, even if you don't do a good job, you still feel proud. Like, and so you can do all of that in the moment and all of that reflection stuff and help them understand those feelings and all that kind of stuff, because they don't know that stuff. So yeah, don't show them your tricks that you love and are important to you. It's easier if you just stop letting them. I taught Sunny way more tricks. I've only taught these dogs the basics, and now I'm doing some more, like, in the sessions and stuff. But you just need to not care. I cared so much about Sunny's training. I cared so much. And I learned, like, it's either he's your dog or he's the community's dog.
Yes.
And you just got to let that stuff go, because it really does. If you care about it, it hurts when things aren't going to plan. Never, ever, ever give a child a clicker. So if you're doing clicker training, do not give a child a clicker. I scaffold these things. So if we're teaching the dog a new trick, for example, I'll be using the marker. So I'll get the child doing mechanical things and I'll be using the marker. And then we have we talk about, it's all scaffolding. So we talk about whose job's what. And, as they get the mechanical skills underway, then I can give them a little go at being the marker, saying the marker word as well. So like your yes, or that's where you would use your clicker. Do not give a child a clicker.
They start copying you, though, I imagine, when you start.
That's why you should never, ever give a child a clicker, ever. Yeah. Do not ever, ever, ever give a child a clicker. Okay?
Even the yes word, I imagine they start.
Yeah. That's what I mean. Like, they're going to muck all that up.
Yeah.
All that's getting mucked up. That's all getting destroyed. As far as dog training goes and doing dog training correctly, your markers are being destroyed. So good job.
You've been forewarned.
You've been warned. You've been warned.
Yeah.
So, which is why I just have like a less impressive version of all those tricks and stuff.
Yeah.
Like, you've got to not.
That's not the goal.
That's
the point. The dog's in the session. Yeah, exactly.
Kids are if you tell a dog to sit and the dog sits, the kids lose their minds. Like, they can't believe it. Yeah. Like, they just can't believe the dog sat when they said sit. So you don't need to do much to impress them. If anyone's so I've got this puzzle. I might have talked about it before on this podcast. I've got this puzzle. It's a wood puzzle that I got from Kmart. They won't have them anymore, but I am obsessed with it. And I've had it for years, and I bought one for every room at the clinic. It's a wood puzzle, and it's all these different shapes and different colors, and it doesn't have a way it's a square. There's no like correct way for the pieces to go in the puzzle. You know how normally a puzzle,
yes,
it's like very specifically it goes this way and you've got to figure it out. There's no way that it goes. Yeah. You just got to get all the pieces in, and it doesn't fit perfectly. So there's gaps. There'll be gaps around. Some of 4 of the pieces are half moons, like half circles. Lord help me. So there's circles in the wood puzzle. And then there's all different shapes. There's triangles, squares, rectangles. I love it for like my flexible thinking stuff. And what I love it for is as you're making the puzzle, you can be making it, but the only way to actually get it finished is to be prepared to take some of the pieces out and redo the section. That's the only way you can really get it done. And that is really hard for some people to take some pieces out is really, really challenging. And also there's no perfect way and there's like no guidance. You just have to.
I think that's something I would have struggled with.
I'm obsessed with the puzzle. I would have struggled with
in a good way though, but like there's no way to do it.
That would be my thing. Like there's no instruction. There's no way to do it. Like you just sort of have to start doing it and be willing to get it wrong. Like I would have been, I think as a child, I would have struggled to start the puzzle being like, there's no like stencils on the puzzle to go, well, this piece fits here because it's
That's challenging. Yeah.
very challenging. I love using it. And what you have also heard us talk about is my dog's puzzles. So my dogs have food puzzles. I use them all the time. The food puzzle and my puzzle are really cool. Like the puzzle. So you just had me talk about like why I like my wood puzzle. Those are all things that are connected to learning to learn. So overcoming some of that stuff and what we're trying to do as the allied health is in the moment. So we have the time. So I've got 50 minutes with this kid. I have the time to give you the task one-on-one with me in this safe space and then watch you unravel about the task. And then my job is to find out why. What is it about this task? Because we're all going to be a bit different. Like you and I were just talking about.
Yes.
What is it about this task that unravels you? Like, what is it? Like, and then sometimes that's really hard to figure. Sometimes it's through like observation of multiple tasks that we sort of start to put the pieces together. So that's my job, but I have time to do that. And then my job is to like, then, okay, go, okay, you know what it is for this kid? It seems to be this and this that are the pieces. Then I work on those things and then I communicate that back to the educator and go, and the parent and go, it's these things here. Like if we can help with these little bits here, this child can actually do these tasks, like da da da. Right? So I've got to figure that stuff out. So what helps me hugely is the motivation piece, right? So we talked about all of that demand and all that avoidance and all that sort of stuff. The motivation piece, if the motivation isn't there, then the child can do 0 tasks. Yes. And I have no information. So I need to be able to motivate the child to even attempt the tasks. And so you're doing lots of like all your relationship and rapport stuff is all important. This is why child psychs are sitting on the floor playing with games and shit. Like that's why we're doing that stuff, is because we're just like, we're all having fun. I do a lot of this stuff, farm-based stuff. I do a lot of it through husbandry of animals and various husbandry tasks, so cleaning animal shelter enclosures and stuff like that. I've got young people that's come to the farm here that I've never had a problem with them. They do every task I ever. Right, we're getting all of these wood shavings out of this chicken pen, and then we're getting the wheelbarrow and we're putting all new wood shavings in there. We're bringing them all over here and we're putting them all out there. They'll just do it. And then I find out like these are kids that will do 0 of anything anywhere else for anyone else. There's 0 of anything anywhere.
The parents must just be like constantly,
what is this? Magic.
Shocked and thrilled. Yeah.
Well, I imagine it's annoying.
True. Nice to know it's possible though.
Yeah, well, that's my job, is that, so that I can figure out why, like, what is it, you know? So I have to figure, and like I said before, like I work with pretty complex, like not all of my books, like I have a lot of people in my books that are not complex at all, and a lot that I've been seeing for many years and all that sort of stuff, but there's some maintenance sessions. But my kind of, anything I end up with, it's likely that there's some complexity there, and then that's my job, is to sort of figure out what it is. Lots of observation, lots and lots of tasks and observations, very similar to the skills that you need to have to train your dogs, train your horses, all that sort of stuff. Lots of observation, lots and lots and lots of observation, and trying to understand things. What was I talking about that? So
learning to learn.
Yeah. So those tasks with the puzzle, what you can do is either we're both doing the puzzle at the same time, so the dog and the kid are doing the puzzle at the same time. That isn't something that I would usually do with my dogs, because my dogs are so ferocious about the puzzle that it would like overstimulate the environment, and it would put a lot of pressure on, like, if they were going to race. If I had a real like confident kid, I might make them race like that to see how they go with the pressure.
When you say that, you mean like the dog working their puzzle and the kid working theirs
at the same time. Yeah, because the dog's throwing the puzzle around, like, you know, like, and they scratch at it, and so it's plastic, and so it's actually quite loud. Like, there's a lot of like,
could be distracting.
This stimulus happening. If I had a fairly confident kid, or a kid that I wanted to see if they would crack under pressure, or a kid that I wanted to crack them under pressure, all the other psychs out there will know. So there might be sometimes the clinical reason for that. So be aware of those sorts of things, right? So because if you get it wrong, depending on the type of client, you can cause now a problem. Now we can cause a rupture that like by setting up stuff that has an outcome that
Yes.
that the client takes significant offense to for whatever reason. We can get it wrong, and you can cause a little bit of a rupture. So just be aware of that. So what can be safe is you do this puzzle, and then I'll let you see Nala do her puzzle, or I'll let you see Oliver do his puzzle, and then you set up the puzzle together and things like that. It's just motivating to get the puzzle done. Again, like I've seen kids do stuff like that like refuse to do anything ever anywhere.
Would it be like, we need to show the dogs how to do a puzzle? Like you do this one first and then they'll know how to do their one, or
yeah. And even if your dog knows how to do the puzzle, like or get new puzzles, like I've got like 8 puzzles, get new puzzles, things like that. And you can go through that learning process as well, like with teaching the dog to do the puzzle. So you have your little puzzle pieces half open when you put your treats in there, the pieces are half open, things like that. But you can have a real planning session with your little person about that. Like how is she going to know to get the stuff out of there though? That sort of stuff. Remember, so your dog's going to be motivated to do the puzzle because it's got food, but your dog needs to be able to hold the mat stay.
yes. Yeah.
My kids are always like, oh, keep him away while I set it, like, because they're carrying the treats around and stuff, and I'm like, drop, and the dogs just drop, and the kids are like losing their minds over the fact that like
yeah,
he's gonna get it, and I'm like, is he getting it? And they're like, no. I'm like, okay, so but you worry about the puzzle and I'll worry about the dog. Thank you very much. He's very well trained. So you can do stuff like that. The other thing you can do, so what we do is lots of like, we do games, right? And so like, I don't know who got their hands on my Uno cards, one of the clinicians. I would struggle. I will not deface a Uno card. I was one of those kids that had to keep all my stuff perfect.
yeah.
Like keep it good, to the point where I wouldn't use things because I got to
Oh gosh. Yeah.
keep it nice. And someone, I don't know what happened to my cards, but someone defaced them by writing clinical questions on them, which I wasn't that happy about. So, but they are very useful. So now that they've been wrecked, I'm like, oh well. So we do things like play games, like where if you get a draw 4, you want to put it down, it'll be like, what's your favorite movie? Like, to get a bit of social skills and conversation going, stuff like that. Things like that. You can do things like that and hide them in your puzzles, in your dog puzzles. Put little slips of paper and have either reading words or math questions.
Oh yeah, that's fun.
And so every time the dog gets a piece out of the puzzle, if they get the piece out, then the piece of paper comes out, and then they've got to do the activity that was in the puzzle. You can do that sort of thing for social skills games.
Oh my God, I would love that game. Right? I would be all over that game.
Totally. Yeah. And you can do that stuff. So we talk about in the course, like I've got my little cupcake molds, my Kmart cupcake molds with my treats underneath. And we use them for like hide and seek and stuff like that, which is hilarious. But the point being that like underneath those cupcakes, like you'll put your treats under there, but you can put little pieces of paper. Notes under there. Yeah. Like, and then as the dog finds them, then this is what the challenge that the kid has to do. And you make it fun. Like, and do like a Simon says, but do like Nala says, if you, Nala says, and then it's like everyone has to
tie your shoes.
Tie your shoes up. Yeah. Things like that. So if you start thinking outside of the box, and so that cupcake game, like the find the treats under the cupcake, you can just do that and then have your little person working on an activity, and that's the race, because that's a much lower stimulus race. So the dogs are looking for stuff, and then you can go, okay, go. Like, all right, how many of your spelling words can you get written out? Like, before she finds the last cupcake, like go. You're just gamifying it. If you do that, the stimulus from the dog and the pressure from the dog is going to be of a lower sensory input than the plastic puzzles. And throw all the puzzles around.
Yeah.
Things like that. You can get big blow up dice from like
fun.
Amazon and Temu and stuff. So if you want to play board games and things like that. So one of the fun parts of our job is making kids lose games, because they need to work on their losing. So if we have to do like board games and stuff, We do practice turn taking. So we work with a lot of kids that won't take turns.
Mhm.
It's their turn all the time, and that really struggle with losing and also struggle with winning. So
Okay. Yeah.
we have to practice those social skills. So, because they cause massive, in little kids, they cause massive problems, those social
Oh,
skills.
yeah.
It is really common that like we can have 3 players of the game. So like me, the little person, and the dog. My turn will get skipped, but not the dog's. The dog's turn won't get skipped. So there's ways that you can play this with your dogs. So think of ways that you can, there's blow up dice. You can just teach your dogs to roll the dice. They just, push it with their face. That's very easy to teach them to do that. So it's just targeting. Things like that. But also just have a look around. Like have a look at your, those speech buttons that everyone's teaching their dogs to talk with, the speech buttons. Buy the buttons. You can preload them with whatever you want on there. So, get them.
Yes.
And load them with like math, science, English, this, that, or spelling, writing, and then teach your dog, like, what are we going to do today? And then the dog goes and presses a button and gets a treat or whatever. And you will find that whoever the kid is, there's a way higher chance that they're going to be engaged in the learning of that topic because Nala chose it and they love Nala. So that's, and then you can try and involve the dog as much or as little in your learning interventions as possible. Don't feel like the dog has to be quite literally involved in everything. So it's okay to have these things. So a lot of this sort of stuff, I do it as like rewards at the end of sessions as well. And I think you should always work towards that, because if the dog has to be involved in everything all the time, the generalizability of that is low. So what I'm actually trying to do is show this little person get the motivation, show them the skill, practice a bit of the skill, and then I want to phase the dog out as quickly as I can, because there's not going to be a dog everywhere
they go. Yeah, at school next to them.
Yeah. So even though we've got a lot of dogs in schools, there's also like 800 kids at the school, so there's not going to be, it is a good idea to phase the animals out as much as you can. So just always keep that in mind. Some of my clients, like the animals have been a big part of their stuff for years. The animals have been a big part. And some of them, the animals were a big part of them engaging in therapy and developing a therapeutic relationship. And now the animals are not a big part. Like they're happy to sit outside around some animals and have a pretty standard talk session.
Yeah.
Which is what my goal is because I don't want them to need,
you don't want codependent
7 horses,
clients.
7 goats, 3 dogs, and 150 chickens to be able to engage in talking about stuff. Like I don't need them. I don't want them to need that forever, but I will use those resources for as long as I need. But that's always my goal, is to get it out of there. What is fun, and something that can always be a part of the goal, is to have something special that we do at the end of our learning session. And that might be, okay, now Nala's going to choose our random trivia question. And you've got your trivia questions on, you might have a brain buster or something, or you've got something under there. We go, okay, so to end our session, we're going to do a game. Are we going to do heads down, thumbs up, whatever, or are we going to do, okay, so like brain games, like Sudoku, solitaire, things like that. Have them out underneath your cupcakes, get the dog to choose one, or staple them, maybe not staple, but tie them to the dog's toys in the toy box and go, where's your toy? Go get your toy. Go see what toy they choose. Out comes the game that we're playing at the end of the class today. This game that we're doing at the end of the session. So my allied healths, you might have Connect 4. Do not do snakes and ladders at the end of the session. You'll all be nodding at it. Yeah. That game can go forever.
It really can.
It really can go forever. I've got a mat, a plastic mat one. You can get them from Officeworks, where it's out on the floor. That's a really good one for getting the big blow up dice for the dog. And then you've got the big mat on the floor because we're involved in it physically. then the dog rolls the dice and then you move their little thing up and down the snakes. And snakes and ladders is the most, you can be winning. You can be winning and about to win, and you get a snake all the way back down to one, which can be really hard for kids. So
I can understand. Yeah.
that's a good one to involve the dog in. So yeah, allied health, you guys might have your Connect 4, Go Fish, snakes and don't do snakes and ladders.
Do you like when you're playing these games with the kids, do you genuinely play or do you assess whether you should win or lose?
I'm pretty good at but I've got some kids that can smash me.
So you really do try to
and I'm not a fan of that at all. I'm like, all right, on to Connect 4. I've had kids over the years that can smash me at Connect 4 too. Like they're just like savants. Like they're just so good. And I'll be like, not this time, but no, just nail. And I'm like, why is this happening? Like, did I just think I was good at this because I was playing 5-year-olds? Like, damn it. So it depends. It depends on the goal. So there's time. So we need to do a bit of in-game play. It's not wise to let kids win all the time because, for one, they'll end up like me thinking they're good at Connect 4 and then go play someone else and get smashed and be like, what's happened?
The devastation.
Acquire a brain injury on the way here. What happened? That person must be cheating. It's good to set, like, you're sort of trying to play with, you're trying to think of what the goal is. So you're trying to give them a little bit of a self-esteem boost, but their kids are pretty smart. They won't even believe. They'll say that you're letting them win if you just keep letting them win. But usually what we're trying to teach them is that it's okay to lose the game. So I would usually lose games and then I'll do a bit of modeling of like, dang it, like, you keep winning, I'll do a little bit of that stuff and a bit of modeling of that and then preparing them that they're going to lose the game. And then, you're just using your clinical judgment all the time to kind of flesh out like what it sounds simple, but it's actually not simple. There's actually so much of like you're analyzing throughout the whole process of like how much give and take is important here. When is the right time to challenge? Like some kids lose once and that's it. They're not playing it. Like no more Connect 4.
Ever.
Yeah. Things like that. But they'll lose to the dog. They'll lose the dog. To play Connect 4 with your dog, you can teach your dogs to target the little board thing. I haven't tried that because I just know that my dogs will send it flying. That's another fun thing. Let the dogs knock over, like build with blocks, let the dogs knock it over because they are not going to get as angry at the dog as what they get at everybody else that knocks over their blocks. All the blocks just falling over by themselves. They won't get as angry at the dogs. So like Labrador tails are really good for that, guys.
Yes.
Labrador tails will knock anything over. I let the dogs walk through the middle of our games, the board games, and muck things up and mess things up and that sort of stuff. If it's, an appropriate challenge for this particular client, it shows that like we can recover from this, and that might be, like a sibling or even their dog at home, and they might crack it over that.
What I really have learned from you, Sam, from this podcast is like I think a lot of people when they're thinking about therapy dogs and whether they, whether that's the right path for them is that like the perception is that these dogs are like perfect all of the time. And like what I've gathered from you is like it's actually their imperfection that you use a lot of the time in the session. Like you don't want a perfect dog. You want them to do their dog thing safely.
I want them to be doing dog stuff and making dog choices, but I want them that as soon as I say something,
you can call it.
I can get control of the dog immediately. Immediately. So we had a little come to Jesus moment yesterday morning. What's today, Monday? When I let the dogs out to the paddock so we can go let the roosters out, little rooster house. And I didn't see wallabies were still in the paddock or wallabies until the dogs like went for it. And I was like, and like yelled out, no. Nala stopped. Oliver wasn't even really invested too much, but he was running along, but he doesn't mean it. And Nala stopped and Penny just disappeared.
Oh no.
through the trees.
Were you with a client?
No, across the creek. I thought across the creek, and I
Oh
didn't even
dear,
bother.
Penny.
I didn't even bother calling her. Like I was like, all right, and she didn't have a tracker on, and I was like, that was a mistake. Okay, all right. Good luck, Wallaby. I think you'll be okay though. All right. So I keep walking down the hill, and I'm thinking, how far is she going to go? So properties around us. I'm thinking she's not going to go that far. Like she's going to gas out, but she's never been like through the fences. So I'm like, how does she know how to get home? Will she just follow her own scent? So I'm like walking down the hill and I get down to like the rooster house, which is where she'd gone, and I started to call her. So I could be like, surely they've stopped running by now. Started to call her and I'm like, thinking I'm looking out across the creek like, huh, okay. And then I like looked and then I was like, where's Oliver? So I like called Oliver because I'm like, where did he go? And then Penny and Oliver came running from the other direction, like the other. So
Wow.
the wallaby must have turned
Yeah.
and run like along the creek. So I was like, oh, phew, good girl. That was close. Even though we're on property and, I don't think she's going to catch it. And they're only wallabies. So if she did catch it, it's not going to, like, it's not like chasing a kangaroo is really bad.
Yeah,
Like,
yeah. She's not going to be.
you're going to get dead. Yeah, that's the thing as well.
Mm.
They'll take the dogs into the water. And then, because then I was thinking, because there was water in the creek, it's been raining. So I was like, is she in the creek? Like, I can't hear anything. Like, she can swim, but I'm like, oh, what's going on here? And then, anyway, that'll happen. I'm like, okay, this morning, I'm like, look out there. A wallaby is great. Let the dogs out. Exactly the same thing happened. The kangaroo was a wallaby in the bushes already, like in the trees up the hill. But she saw it and I was already on the lookout.
Ready.
So I saw her see it and stopped her straight away, which is Penny, no. And she stopped and looked at me, and then she looked back and went to go again. Penny, no, which was enough time. Like it ran off.
Mm.
And then we went on about our business and let the roosters out. And I was like, cool. That's good that works that early on, because she had a real win the day before.
Yes,
Like,
that would have been
no,
really
seriously.
reinforcing. Yeah.
Very fun. She's a staffy. That's
Yeah.
very fun to chase that guy. Like, wow. That was really, really, really fun. Because then it was around about the rooster house that it had run past. And so when we were hanging around down there and letting them out and feeding them, she's like sniffing around and like all jazzed up because she was like, remember that time yesterday when I got to chase that wallaby? I was like,
Living her staffy dreams.
yes, I do. So it is very important to me that, and especially with such a reinforcing event yesterday, that this morning I was able to stop her. That's not good dog management. So don't take that away from it. She should have been on a lead or on an e-collar, but that's not how I live my life all the time. It's usually, I was in my pajamas. There you go. I was in my pajamas drinking my coffee. And I had.
Can't imagine you just like bolting through the bush. Yeah.
Oh, no, and I'm not. and I'm not doing that. I'm like, she'll come. I know enough about dogs and wallabies to know it's very unlikely she's going to catch that wallaby and she's going to gas out. Like she'll run out of steam. Like she's pretty fit.
Oliver's herding worked. Come on, Penny.
Come on, Penny. Yeah, that's poor dog management, but also it's my paddock, so whatever. But that the idea is that the dogs can just be dogs. But if I say drop on your mat, whatever, then I can get control of the dog and the situation pretty quickly for those reasons that we talked about just earlier. But yes, the dogs don't need to be perfect. They just don't need to be perfect. I don't want to put on like a perfect show with the dogs, because I'm like, what's the point of that? Like, how's that useful? Like, there's been so many things that I've been able to teach or show people or model, or there's been just so many things that I've been able to do that by finding similar challenges in similar ways with the dogs. And if you've got a perfect dog, like Sunny was a perfect dog, if you've got a perfect dog, that's fine. You just need to be creating, you're just going to do more of the like, okay, well now he's going to find all of the cupcake molds, the silicon cupcake molds that have got our spelling words in them, and then we're going to do our spelling words, you know, like when you teach him to go and retrieve the thing and bring it back, and then he's got to wait there with you and you go, okay, the next word is this. Okay, Sunny, next word, go find it, you know, and you bring one back and go, okay, the next word is this. Like, you know, that you can do all of that sort of stuff as well. But like, remember what I've said a few times about who my clients are. Like
Yes.
that, you know, so it serves me well. Like I've got a horse that has given me a run for my money at the moment. One of my horses is giving me a run for my money at the moment, and quite literally for my money, as my trainer is now on speed dial. So
Oh,
she always is anyway. But yeah,
needing that extra support.
doing some intensive lessons at the moment. And he, like, this happened to be like last week, he was doing some stuff in the paddock, and it just happened to happen at the perfect time that there was a person here that needed to see that, really. And also I took that opportunity to intervene with, like, the horses in the paddock, intervene and do a lot of modeling around calming him down and, you know, whatever, blah, blah, blah. I mean, I can't go into details with this sort of stuff, but yeah. So it's how experienced you are as a handler. So those things can go badly, for example. So if things go bad, so say Nala, Penny, like I don't put the dogs out in the paddock in client sessions, no way. But if Penny chased a wallaby in someone else's session, that is not good. Like that's because they're going to be freaking out. And then I'm also like, well, I don't know what the dog is. Like, you know, which isn't actually very good modeling of dog ownership either. People probably just listening about, oh my God, but I'm like, they're all 10 acre properties around us. It's a long way till she gets to a road. She's not going to run all the way to the road. She'll come back. So, and she's a sook, so she'll come back. So I was kicking myself though that she didn't have her GPS thing on. The things, don't put yourself in a situation where things can go bad. Build yourself up, get to know your dog really well, build your handling skills really well, build your confidence really well. Like I actually do know that I can stop that dog. I just didn't see that wallaby, and I stopped her this morning. So there's what level of experience you are as a handler. Like I break in wild horses, like, you know, so my level of experience and what I'm going to use in my sessions, even though that was like that was just a visual, that was just an observation thing. What I'm going to use is going to be different to what a novel handler should be using, because you probably shouldn't have 3 dogs in a session, and you probably shouldn't have this going on and that going on, because you can get hurt with the horses. You can fail at stuff, which is just, you know, good and bad. There are times when that's good and bad, but it all depends on what the client's going to take away from that and what their experience of that is. So I don't want to be in a position where I actually don't have control over this. And because I have to do so much to make sure that this is of benefit to the client in some way. So then your clinician skills come into play, where you're like, something unexpected might happen or unplanned, or something that's not that good might happen. And then you've got to spin it and make it useful. But and so also your dog can run out onto the road and get hit by a car, and then you can spin that and go, so don't run on the road. Like that's not good, guys.
Like we don't want that.
You can't, that's not what I mean. Okay. And I don't mean just let chaos ensue and then be like, and that's why you should be looking left and right, because, you know,
Could
and that's
you
why
just imagine that would be the worst thing ever. Yeah. No.
Oh, Lord help me if the day comes when something really bad happens in a session. But we listened to the Dr. Olga podcast and talked about all the things that I've had to deal with. I mean, nothing really bad, but yeah, listen to the Dr. Olga Pet First Aid for all my stuff that I've had happen. But yeah, so it's not just chaos. And what probably the takeaway message is how experienced you are as a handler, not how confident you are. How experienced you are as a handler is going to be the main thing that you need to take into account when you're taking risks. So it is different for me and the types of things that I'm going to do, because I've got my experience as a clinician, my experience as a dog handler, my experience as a horse handler, my experience of, you know, husbandry of farm animals. it's different. If you're, a brand new clinician or working with a new client group, or you're in a new work role or new workplace or things like that, like then already you play it safe there.
Yeah.
You got a new dog, play it safe. You got a young dog, play it safe. You're still developing your handler skills, like, your dog management and all that sort of stuff. Play it safe. It's easier to start, easy, like all those reading examples and stuff we talked about, like that's minimal input from the dog. Like that's not hard, that stuff. So
I suppose hearing that, it's less about letting anything happen and more about knowing your dog's behaviors and using that to your advantage.
Yeah.
Like they're existing as a normal dog and those behaviors are predictable for you as the handler.
Yeah. So instead of being like, oh, I need to keep Nala on the mat the whole time we play this board game because she might knock it over, let her off the mat. See if she knocks it over.
Like you said with Sunny being like, okay, so Sunny's going to come into the room and he's going to have a toy and then he's going to want you to throw it. Like, that's not chaotic, but it is a dog being a dog.
And then I would let him, and I wouldn't have him on the lead. I'd let him out of his crate in the other room and let him run into the room. So he'd come into the room with this big presence. And I'd be like, and I'd go, he's going to make this noise. As he laughs through his toy.
Love that sound. Yeah.
And he would just be doing that snuffling noise and wagging. And I'd be like, and I would say, like, a big waggy tail, he never jumped up on anything. Yeah. Like, he was never a jumper because I think he had bad hips when he was younger. But, and I would let him come in with all that presence, and people would just be immediately in love with him. Like, just immediately in love, even though it's a lot of presence to come into a room. Same thing with Nala. Like, she has her little routine. Oliver has his little routine. Just let him be. Just let him be dog. If you know that when something is going, you can be like, hey, stop, and get things back under control again. Don't just let reckless abandon ensue, because that doesn't make clients feel safe. That does not make clients feel safe. I'm going to let my dogs help me to cause some organized disruption.
Yeah, like organized chaos almost.
Yeah. I want some disruption in some sessions, because that's the point. So I'm going to let my dogs help me with some organized versions of that. If they are, what's the word? Like, they're just, like a disorganized chaos. No one feels safe in that, around that, and no one respects you, and no one likes your dog. Some people might like the dog. Some people might like the dog, and that's fine. A lot of people aren't going to like the dog, and they're not going to respect you as well. So, and that's really pretty important, that you're making it, you're doing modeling. Like I said at the very top of this, you're modeling you who you are as a person and as a clinician. So people expect, particularly from their psychologists, that their allied healths especially, and their educators, they're expecting a put together human being. So you need to present like that. Yeah.
I suppose also, Sam, I know we get people sometimes who'll say, oh, I'd love my dog to be a therapy dog, but they're so high energy, or they're quite a big presence, and thinking that that's not what a therapy dog is. But what I've also learned from you is that those behaviors, as long as, once again, they can be under control, are really good, like qualities in a therapy dog. Is that right?
And like our specialty, like my specialty really as a dog trainer, is stopping dogs from annoying me and ignoring me. So that's all about impulse control, and it's all about relationship. So if I don't have value to Penny, because as we know, she's my partner's dog, if I don't have value to her and bring value to her life, she's not going to care that I say no to her out in the paddock about chasing a kangaroo for the second day in a row. She's not going to care about that. But I'm her buddy. Like, I'm a, and she knows, like, I bring all the fun. I opened this gate and let you out here. Like, have value to her, and that's why she can listen to me. She's a sensitive dog, so she's never needed a lot of correction. She gets corrections, but she never needed a lot of correction. Probably most dogs don't. But what I mean is, she's just as sensitive to, like, if you're like, hey, I'm not happy, she's sensitive to that. but she's also a staffy and with a high prey drive. So, and she chased a kangaroo yesterday. I don't even know how long. It felt like ages, but it was probably a minute and a half. Quite successfully and self-reinforced that way. So, there's a lot of relationship that comes into that, and you don't just get that by telling dogs what to do. That's not how you build a relationship with them. It's by spending time with them, quality time with them, meeting their needs, giving yourself value by bringing value to their lives. And then through your everyday like obedience and manners training, having clear communication, like really clearly communicate, clear boundaries, be observant of them. Who are they? What do they need? How do they work? What do they like? What do they not like? You've really got to, you're going to really get to know your dog and really build a relationship with them. That's where you get your impulse control and your quote unquote control of the dog from. It's not from use. Like I can put an e-collar on and I can stop the dog from doing all sorts of things, but it's not, they know when it's on and when it's not on. I had that conversation with Pat. And so, and like like if you're not going to get relationship just from doing that. That's not going to happen. Some dogs just take longer to mature than other dogs too. So if you've got a dog that's 4 years old and it's, still running amok and a bit chaotic, there's every chance that we can help you with just some impulse control. Like, let's just have a look at their dog and the relationship, put some impulse control in, put some boundaries in place, and give yourself some more value to the dog. We can probably sort that out. Some dogs, they're 12 months old, they're not going to settle down until they're 2. So they just need increased management to help them through. Penny was like that. Like if I was trying to make her calm by 12 months old, it would have been just a fight. Like it would have just been.
Wouldn't have been fun for anyone.
It's no fun for anyone. And I suspect that's what's happening with my horse at the moment, who's 5, but a breed, we think, that is slow to mature. So I think we've got a bit of that going on.
That's still an adolescent period for a horse. I'm not.
Yes, and for the breed. So we think he's got Arab in him. His winter's foal. I think he's got Arab in him, and it's just like a foal. It's like walking around a 15-pound foal that weighs 550 kilos or whatever he weighs. Like 500 kilos, but a foal in the brain. Like, so that's where I'm like, this is now tricky because he's so big. It's like Kiki. Like, he's so big, that we actually kind of need to help him mature a little bit here. So, and that's a multifaceted approach to that. And sometimes it's just time. And like with your dogs, a lot of the time it's just going to be time and management, as long as they're being safe, like it's time and management, because you don't want to squash all of that out of them. Just like I don't want to squash it out of this horse, because it's going to benefit us down the track. So he is the kind of horse that could like easily be an eventer. Like he could easily be doing cross country, show jumping, dressage. Like he could easily be an eventer because he's got the attitude for it. So I don't want to squash that, but we need to make sure that we've got really clear boundaries in place and we're not just letting it reckless unabandon ensue. But he hasn't hurt anybody, but there's absolutely potential there for that because he's such a big animal. So, and he's just acting like a baby. So we need to help develop him. And that's why I'm getting, again, my trainer out. It's not free. It's not free. Doing 2 lessons a week that are not free.
That's similar to our juniors program.
Taking steps backwards too. We've been riding that horse for 3 years. On and off, he had a Sweeney shoulder for a year and was spelled for a year, but he was started under saddle gently at 2 and then spelled for a year. And then
I don't know what you mean by spelled.
The horse people will know what I'm talking about, saying to them, I've been riding this horse. Like, we've been riding this horse and it's all good, but I can see that there's problems under the surface that are going to arise. So it's a massive, and my lessons at the moment are groundwork. So the point that I'm making is I'm going all the way back.
You're back to foundations.
I'm going back. Yeah.
Yeah.
So, because that's one of the things that people can struggle with their dogs is that, like, sometimes you need to go back. Like, you just need to go back, and it feels like to some people it can feel like a
You failed
like
or
like a
regression.
failure, it's frustrating or whatever, and like, or you're spending money on it, that sort of stuff. But think of it as finding gaps. So we're just going to go back and addressing something back here that wasn't even really a problem. Like, it's only really become a problem in the last, probably since he's become a real teenager, but going back and starting back here again and teaching some real, so what we're teaching him at the moment is, so his threshold for excitement and or like his startle response, he's operating, in my opinion, he appears to be operating just underneath that threshold. So his arousal level, he's ready to explode all the time. And whether he explodes, he's actually safer when he spooks, because when he explodes into excitement, that's when we get the jumping and kicking and running and that sort of stuff, and it's dangerous. So where he's living is just underneath the threshold of that. It doesn't take much to send him over the edge. I don't know if this is interesting for people, but
yeah, I'm finding it interesting.
What the goal is just exactly like my human clients, is I've got to build that threshold, like increase his window of tolerance, basically, like build that threshold by massaging it. And so what we need to do, so if you picture this on the ground, walking with him on a halter, take 4 steps slowly. So you're walking like quite slow, and then take 4 quicker energy steps. Even just at that transition from the slower steps to the quicker energy steps, he would like throw his head and like,
wow,
like he's going to jump, like he wants to jump, like that sort of thing.
Any opportunity to
He just gets excited. He's just excited. And that's why he would be a great eventer. Like he's like, whoa, like, let's go. But when he does that, he kicks out and, has the chance to bolt and all that sort of stuff. And then when you try and stop him, so if you like hold him, then this is what I've realized this morning is what's happening, is you try and stop him and hold him, and he sort of comes onto you, and then you've got to push him off you. Like you've got to get him in his own space again. But then throughout that whole thing, like he's just like, yeah, and I'm like,
I feel like a lot of people can relate with their dogs. Like that same adolescent on a smaller scale, that same adolescent period of just
taking deep breaths,
managing. Yeah.
And I try and remember that, like, and I like try and think about, like we're obviously going to be talking about this sort of stuff on school and things like that, but he's frustrating, but he's double barreling his back legs out and has nearly kicked me in the head like 5 times. So, so it's like you get frustrated and with your dogs and that sort of stuff, but a lot of the time everything's actually fine, and you've just got to be patient, and you just got to take deep breaths, and you just need to review your training plan. You just need to speak to your trainer. You just need to do these things. You're not getting kicked in the head by 2 back feet of a domestic born Brumby who is having the time of his life. And he's just a little rat bag. He's a rat bag. He's Winter's child. I love him, but he's a rat bag. He's a real character. He's very, very funny. There's many, many things to love about him, because he's like a foal. He's like all the cute things that foals do. He's like a foal. So even just that, like slow steps, faster steps, slow steps, fast steps. So what I was showing him is what I'm working on, and I was doing some steps with him this morning, and from I go from slow steps into faster steps, and if he brings his energy up without carrying on like an idiot, you just straight back to slow steps, and you just got to really massage that and go, it's actually okay for you to go from neutral to a bit more energy. It doesn't always mean go to 100.
Yeah.
Sometimes it means go to 15, 20. They don't have to throw your head and kick and fart and carry on every time, buddy. But yeah. All right, we need to wrap this up because we're taking up everybody's whole life with our podcast episodes.
We are.
Nice. And to finish this up, so you can log back into school and see what we're all doing in there. Everyone that's joined so far, welcome, welcome, welcome. It's been great having a few little chit chats in there. We're preparing for classes tonight. which you guys aren't listening to this on the day that we're recording it, but yeah, good stuff.
Thanks, Sam. Thanks for a great episode.
Thank you. Thank you. I hope people found that useful and having a little chat about the stuff that we do
It's
and get some
fascinating.
ideas. Yeah, let us know if you have anything else that you would like us to answer or chat about. And we'll see you next time.
See you soon. Thanks for listening to the podcast. If you're interested in studying with us, but you have a few more questions before you get started, please get in touch with us by emailing info@therapydog.com.au or visiting our website, www.therapydog.com.au, for more information and our FAQs.